So first of all, Sharon, I wanted to say thank you, because what you did with me with the operation was absolutely incredible. And the background to it is that I needed to have a really intrusive, very traumatic operation. And I was really scared because I have a history of being very sensitive to chemicals, to anything. I mean, if somebody came by and they just had their suit dry cleaned 3 or 4 weeks before, it would wipe me out. I wouldn't be able to speak, I wouldn't be able to concentrate, and I would have to go to sleep for 2 days. So I was really, really, really sensitive. I couldn't be in a car which was less than 5 years old because I could still smell the upholstery. And here I am, I'm told that I need to have this terrible operation, 3 hours probably, and a lot of painkillers afterwards. And I'm just nervous about being in a hospital environment to begin with, just with the cleaning fluids that they use, let alone anesthetics and painkillers and who knows what else. So I was really, really scared, but I didn't have a choice. I needed to do it. So I got to see you a week before. And first of all, you were amazing because you listened. You listened to what I wanted. You listened to my worries, to my fears. You listened to what I would like it to be, that I would like it to be easy. I would like it to it's okay to have the medical intervention, because I don't take any medicines at all, nothing. My children grew without having any medication at all. So this was all new to me, this whole hospital regime. And you listened to that, and you made a CD which was specially for me, about feeling healthy with every cell of my body, feeling healthy and vibrant, and I'm getting all the good things and from the medical intervention, but my body is straight away getting rid of all the toxins, and I can deal with everything, and it was just right for me, just what I needed. You got it just right, you heard, you listened. The funny thing was that when I saw you, the anesthetician called me when I was here with you, and she wanted to talk to me because I wanted to talk to them beforehand for them to understand that they can't treat me like a normal patient. And I said, oh, isn't it funny you're calling me now? I'm with my hypnotherapist. And her reaction really blew me, because her reaction was, oh, that's wonderful. So you can be prepared. That's great. So when I got there to the hospital, I talked to the other anesthetist, and I said, look, I once was on general anesthetics for 20 minutes, and it took me 3 months to recover. So we need to see what we can do. And she said, okay, I'm going to give you a drug that is a different one, maybe not as strong, but you'll need morphine. You'll need morphine for 3 hours. And I said, I really don't want painkillers. And I definitely don't want painkillers automatically after the operation. If I am in pain, then of course I'm not going to be stupid. If I can't take it, then I'll ask for something. But I want to be the one who's asking for it, rather than being administered straight away, automatically. So she said, okay, you know what, I'm not going to give you morphine, I'm going to give you something else. But it's such a traumatic operation that, your blood pressure can drop, you can have a heart attack. You do need, your body knows that something terrible is happening to it, and it reacts, so you do need something. And in the end, she said, you know what, I'll give you the painkillers only for the first 20 minutes of the operation, which are the worst. So they really bent over backwards for me and gave me as little as possible. But she said to me, I don't know anybody who had this operation and didn't need painkillers. I'm going to be with you straight away and give you painkillers. So she runs to the recovery room, and she says, do you need painkillers? Do you need painkillers? And I was like, no, I'm lying in the recovery room already texting you, I'm in recovery. And started doing my exercise, in my feet exercises, moving my feet straight away. And she said, I'm saying, no, I'm fine, I don't need any painkillers. And she goes back to the operating room and she just mumbles, I've never seen anybody like you. I've never met anybody like you. And then throughout the night, I was on a high dependency room, in that room, and throughout the night, the nurse came every half an hour and asked if I needed painkillers. And I said, no, I'm fine. And then as she left her shift in the morning, she went to me and she said, look, I just want to tell you something. I've been a nurse for 26 years. I've never ever met anybody like you who's had an operation like that and doesn't need painkillers. And within hours of the operation, I got up in the morning, I took my gown off, I put normal clothes on and started doing exercises. So I really think now, after having this experience, that everybody who needs an operation can really benefit from talking with you and having a CD like this, even if they end up with painkillers in the end, even if they did need all the anesthetics, still, I think it will be really useful and really beneficial because there's some sort of reprogramming in the brain. So I think the recovery process can be so much faster and better. I mean, it was a huge operation. A big part of my body was being cut off, and I was fine. I was absolutely fine. And to have an operation like this without pain, I think it's unheard of.